Okay, so it's frame 21536. You mentioned you had 8 cases the day before. You knew exactly what they needed, and you had a huddle at the beginning of the day with the technician. Did you hear that?
I did.
The video speaks for itself.
And what exactly did you mean in that conversation right there?
That I had a huddle at the beginning of the day. What are you asking me?
You had a huddle with who? The technician?
I just said yes.
Okay, and you looked through the files to see, you said some of them had more lambs than the other. You mean laminaria?
I didn't look through any files.
Okay, so how did you determine, how did you know when you had the huddle which cases were the fetal tissue cases?
No, I knew we were going to have 8. I won't know until the chart is in the room which one is a donation and which one isn't. I don't go and look at all the charts at the beginning of the day.
So why don't you describe the process that you're talking about here? You have the huddle at the beginning of the day with the technician.
Yes.
And what does she tell you during the huddle?
She tells me what tissue she's looking for that day.
So she says, I need 8 livers, or I need 3 hearts, that kind of stuff. And then what do you do after that?
So I don't think she ever told me a number. I think she would say things like, I need liver, or I need heart.
Okay.
I would keep that in the back of my mind, and if I saw that tissue while I was doing the procedure, I would put it aside for her.
So, and you're talking about procedures where the patients were already consented for fetal tissue?
Correct.
Because that would be flagged in the file.
It states the record.
Most of the charts would have some kind of flag that I could see, yes, that it was a tissue donation patient.